Hello, everyone, and welcome to Smartkarma Corporate Webinar. I'm Vidhi Bhatt from the Corporate Solutions team at Smartkarma. This week, we are hosting Meta Health Limited. We are very glad to have with us Dr. Vas Metupalle.
Hi there.
Dr. Vas is the Chief Medical Officer at 5Digital. And we also have with us Dr. Bernard Ang, the Executive Director at 5Digital.
Good afternoon, everyone. Thanks for joining us.
5Digital is Meta Health's fully owned healthcare platform company. And we will start this webinar with Dr. Vas and Dr. Bernard walking us through a company presentation, after which they will engage in a fireside chat with Smartkarma Insight provider, Taneja.
Thanks. Hi, everyone. Nice to meet you.
We will be taking question and answers. So I would like to request our attendees to post your questions at the bottom of your screen on the Q&A tab. During this webinar, I will also share links with you on how you can connect with our speakers today, with Dr. Bernard, Dr. Vas, as well as Samir. So keep a lookout for messages in your chat box. I will now hand it over to Dr. Vas and Dr. Bernard to start with the presentation. Over to you.
Thank you very much, Vidhi. Thank you very much, Samir, for having us here. And thank you, everyone, for joining us. Some logistics check. Can you see the slide that is being projected on my screen?
Yes, we can.
All right, good. A very good afternoon, everyone. We are here to share a bit about Meta Health Limited. We are fully incorporated in Singapore and we are listed on the SGX Catalyst Board. So what we want to achieve is data-driven and improving outcomes for our consumers and patients using technology. Now, a bit of background. Meta Health Limited was previously known as Metal Component Engineering, and the CEO, Mr. Chua, decided that he wanted to pivot into healthcare. And the reason for pivoting into healthcare is because he believes there's opportunity in the digital health economy within ASEAN. Here we know in the Southeast Asia economy, lots of people here are digitally engaged, but also there's opportunity for us to engage in medical care for this group of people. Hence, the journey of pivot started in July 2021, where he started acquiring 5Digital, a fully owned company that is incorporated in Singapore also. And from there, the journey started. Today, and a few months ago, we changed our name from Metal Component Engineering to Meta Health Limited. The purpose of changing the name is to show that this company is moving full steam ahead in our healthcare journey. And to do that, we have separated the organization into two separate divisions. One, which is the engineering division, and another, which is the healthcare division, which I will tell you a bit more about. In the engineering division, all the legacy business are in there, and now it is called MCE Technology Holdings Private Limited, and all the legacy engineering business is in there. And in the healthcare arm, 5Digital Private Limited is where all the healthcare businesses are consolidated under. 5Digital Private Limited owns 85% of Gain Health Private Limited, where we provide clinical services, home care, and e-pharmacy in Singapore. We also own 70% of PT Guido Digital Medica Indonesia, where we are in the process of starting digital hospital footprint in Indonesia. And to make us successful, we need the technology platform. Hence, we invested in a very forward-looking Internet of Medical Things company called MedTel, based out of India, so that they can provide us the platform to succeed. Last but not least, we also invested 18% in Adazal or Triber, where we are a licensed social commerce platform, gaining numbers, gaining people at the top of the funnel, the healthy, well-being people. And with that, I'll pass it over to Dr. Vas to tell you a bit about the healthcare ecosystem that we are trying to build. Over to you, Vas.
Yeah, thank you. While 5Digital is looking at opportunistic but very well-coordinated and integrated kind of platform. We started with Metal, as Dr. Bernard said, looking at the telemedicine as well as IoT, well integrated. We had Gain Health, which had the e-pharmacy part in Singapore. And we have been licensing and working with other partners, which usually as licensing, we don't make too many announcements, but we have been looking at cloud technologies, analytics, and ways of improving data aggregation within hospitals. Because our investment in Indonesia is where we are really focused on this more integrated hospital-based platform. And in outpatient care, like in Singapore and in Malaysia, we're looking at primary care-led pharmacies and helping with central pharmacies and creating a very easy access for repeat prescriptions and chronic disease management. So if you look at the funnel, like there's, as Dr. Bernard mentioned, the well patient, and then there's a sick patient. The well patient is a huge number, and here we can tap on them for preventive health. As you could see recently after COVID, more and more, it's the focus is on preventive health, and social media and other channels where we are going to find these people who are looking for content and about certain conditions, and we can get them into a referral or triage kind of engagement by chatbots like WhatsApp chatbot and things like that. And then we can bring them online for care, either with a nurse or a doctor, or referral from online to offline care to a specialist. And the three countries, as mentioned, we are focused on: Singapore, Malaysia, and Indonesia at the moment. Yeah. Okay. The next slide. Yes. So we are looking at a way of engaging the customer and coordinating care online and working with the offline providers. So it's a managed care kind of proposition that we are growing, and increasingly the traction with providers after COVID to find a way of collaborating and providing services in an outpatient setting. And not everyone's going to go to working as a single medical center basis, right? Where people expect all the services to be provided in a medical center. So increasingly home-based services is very important. Gain Health in Singapore was part of the home recovery program for MOH, and we were providing a lot of nursing services for testing at home. And increasingly, those testing has moved from PCR testing to blood tests for diabetes and other conditions. And increasingly, we will be able to provide elder care at home, physiotherapy at home, and certain follow-up specialist teleconsults as well. I think we are leading currently in terms of innovation in this space, and I think the future for the company and opportunities is kind of pretty vast. If you look at how hospitals to home is going to grow, because doubling of the healthcare expenses is the reason in the last 10 years where the government has now looked at the next 10 years as a place where preventive care and outpatient care is going to be very important for us. And we are right there in that space. And we believe that rapid growth last year we saw in numbers. We published that we were growing at more than 30% in terms of number of patients every quarter. And this is not something that's going to just level up, because we do see the chronic disease wave after the pandemic. People are having pent up requirements. So this is where we will innovate and try to do the care coordination. So yeah, I think that's the this. Next, is there? I guess we have a Q&A session. Yeah.
Yeah, there's no more slides. Thank you, Vas. I think your connection is quite patchy off and on, but we'll pass it back to Sameh to host this further.
Great. Thank you for this opportunity to host the webinar and have this fireside chat with you. And so I'm going to start, Dr. Bernard and Dr. Vas, by just asking you about the businesses as buckets. So we have the metal component business, which is one bucket, which you're, I guess, gradually going to de-emphasize. And then, of course, there's the medical business, which is your growth engine. So if you could give us some color on what's the future of the metal component business. Is that something that you're going to slowly hive away with time, or is it going to be a cash cow for you? Maybe that would be a great start.
Thank you very much, Sameh. This is a very frequently asked question. I'll try to answer what I can, and then Dr. Vas can also add color to it. For us as a listed company, as we have seen, there's two clear separate organizations. The book value of the engineering arm is between 13 to 17 million now. So we will continue to explore strategic options for it, and we will decide after offers are on the table, or we'll see what comes on the table. In terms of the healthcare arm, we believe there's a lot of gas still behind it, and Dr. Vas will maybe be able to give you a bit more color on the healthcare arm. Vas?
Okay.
Yes, we do see that the opportunities around the region is pretty exciting. I'm currently having this patchy connection due to rain, I think, in Jakarta. I'm just outside in Jakarta, and at the moment, maybe sometimes it's patchy. But in terms of opportunity-wise, the kind of growth has just started in digital health. And when it comes to e-pharmacy space, there's opportunities to streamline purchasing for several B2B partners, like small hospitals in Indonesia and so on. So we do see that there's going to be pretty much open competition here, and we are going to participate more and more, and we will be reporting back quite frequently on the progress. And we are one of the few digital health companies that's listed, or I would say, other than Hong Kong, in Singapore, we probably have one of the only ones. So as a market, you can follow what we are doing, and I guess we will be able to update and feedback the opportunities out there in the region. Yeah.
So just to encapsulate, as of now, your net cash 7.3 million Sing dollars, which is about, call it roughly a third of your market capitalization. If you were to hive off the assets at book value, you would be somewhere around 20 million of cash today. Am I right in assuming that, if you did it at book value, obviously there could be other metrics. I understand that you had disposed your Shanghai facility at 1.4 times net asset value. So it could be more than that. But if it were done at book value, you would have about 20 million. And that is today, you would have about 20 million of cash on your balance sheet. Is that fair to say?
Roughly, you're right, Sameh.
Okay.
And
right.
we expect it to be higher than that, because
Right.
it usually
Yes.
will not dispose at book value. Right?
Of course. Understood. Okay, great. So I'll now abandon asking questions about the metal component business and move on to your exciting business, which is the medical health business. Of course, it's a very nascent business, and just for the understanding of shareholders or potential shareholders, you guys had about 1.3 million of revenue from the medical health business. So if you could like sort of give us a brief understanding of what drove it geographically and what drove it from your business divisions within that medical business division, like was it e-pharmacy or telemed or the SaaS business, that would be great.
Yeah, I'll probably take that briefly and then pass it on to Dr. Bernard. The growth, if you look at the numbers, it was only a half-year reporting for medical, because the acquisition of the healthcare was in July 13th last year. And the quarter-on-quarter growth that we see is continuing. So what we project is, I guess, at least double what that number is, plus the growth for 2022 organically. And that's within just Singapore. Because the revenues from Malaysia and Indonesia were not captured in 2021. So 2022, you'll see new revenues from Malaysia and Indonesia as well. So overall, yeah, we are pretty confident about the multiples and the way we see the profitability as well. Our business, that the segments that we are in, e-pharmacy, where we are more or less competitive and yet profitable, because we are not, most medical groups use pharmacies as a way to subsidize the rentals and medical doctors services and things like that. Our focus on e-pharmacy has a way to support these medical groups, and having a more lean operation when it comes with technology has helped us in keeping a very significant margin on that business. So that's really where our profitability is. On the tech side, IoT and the future, the data portions is very important for us to understand how to make or repeat kind of prescriptions and follow up with patients carefully, and be able to increase the average revenue per person as we grow the number of users in our platform. Automation is another way we can increase productivity in this e-pharmacy segment, and we are doing that. Currently, we are looking at automating robotic packaging and things like that for chronic patients and repeat patients. So I think the volume growth, together with naturally the regional expansion, is going to show the top line growth as well as profitability this year. Yeah.
Understood. Great. And just again, for shareholders to understand, you guys were profitable. You had about 240,000 profit before operating profit. But then on a PBT level, you were kind of loss making, and there were some unallocated costs of around 600,000. So if you could just walk us through a bit on costs and what you expect profitability of the business to be, that would be great.
Yeah, so let me take that, Samir. As you know, as in any acquisition, there is a lot of legal fees, consultancy, valuation costs. Right. So that is the one-time cost which we will not see as we move forward, right? So there may be still a bit here and there, but as we move forward, that will disappear and our profit will continue to be dropping straight to the bottom line, right? Removing all the unallocated costs, right?
All right, fabulous. Okay, so maybe if you could, walk us through the telemed space, in Singapore. It's obviously hotly competitive. There are so many players like MHC Care Plus, there's Doctor Anywhere, there's a White Coat, there's Ali. the Satacom Health. So it's obviously a very competitive space, and I know the pie is huge, but you know, what are your competitors doing, and how are you sort of differentiating yourself from them? Or is this like a business where you view it as like the pie being huge and you don't need to differentiate yourself much? It's just sort of you, by virtue of the pie being huge, you automatically gain share in business.
Sure. Maybe I'll start with that, and then Dr. Bernard as well can continue. So if you look at primary care, just the first part that we are in, and outpatient care, you have something like 600 million a year in just Singapore as a outpatient care market, which is expected to double in the next 7 years by 2030. Right. So that's already a strong growth. So primary care companies like physical clinics, GP clinics, are competing in this space. But the newer telemedicine players, like as you mentioned, are entering, and yet to hit those kind of revenue numbers as the established GP clinics. The awareness, the adoption are all coming in now, thanks, I guess, to the increased digitization and acceptance since COVID. And it's not going back down. People who have tried it are continuing on the platform. So now I think it's the time you have to start looking at the numbers, how we will compare with the brick and mortars that are listed, or in terms of the primary care groups and their costs and the efficiencies, how they can compete with more online groups. And we are in a kind of a space of both retail pharmacies and primary care companies in Singapore, at least. We are now entering the home care market. That is even a new market segment. So if you look at entering that market, like the growth there probably will be exponential because of the need for elder care and home care services. When government has prioritized this and said they're not building any more hospitals, so it's going to be mostly hospital at home kind of services. So we do see this as a way to compete now, even with the tertiary and secondary care market, and so that if you look at the cost of care, there's 22 billion just in Singapore, and so the market size just becomes as big as I mean, it's probably one of the largest industries, right, within the country. So we do see the opportunity as a digital health player to now compete in going beyond primary care and into more of a market share. Yeah.
Understood. So the pie is huge. Right.
To add more color into that, Sameh, while the pie is huge, segmentation is equally important.
Right.
Today, just a telemedicine provider, I would say that is table stakes. How we want to compete, how we want to segmentize is important. We want to go after chronic care. Patients with chronic care now, as the government has announced in Singapore, will need good care. And a lot of this care can be provided with them at home. And we need to have an interspace between offline and online. Maybe out of your 8 visits a year, 6 could be online, 2 could be physical. How do we then package the surrounding care, whether it's phlebotomist, whether it's your specialist care? That is what we want to provide. So that is one segment that we want to take care. Just like how Singapore is having a war against diabetes, there's a lot of other chronic cares for this group of patients, right? It's diabetes, hypertension, ischemic heart disease, hyperlipidemia. Those patients need care, and for life, I would say. How can we engage them, capture them, and build the average order value as we move forward? Because we know medicine is only one part of care. The nutrition, the exercise, all those needs to be taken into account. So that's how we want to capture. And that is only for Singapore. Then if you replicate that in Indonesia, you replicate that in Malaysia, that's where our revenue will continue to grow. And that's why we are also strategically partnering some of the specialist clinic, right? That's all work in progress. We are reviewing strategic options so that we have the comprehensive care for whoever is in our ecosystem.
Understood. Great answer. So, again, kind of looking at these players in a bit more detail, we can see that they've all been raising money, and just to elaborate, Dr. Anyway has raised $145 million in the last 2 years. Halodoc, which is in Indonesia, has raised a substantial amount of money as well, about over $100 million. Or some of your competitors have chosen to actually connect with larger groups like Dr. World has Raffles Connect, and or guys like White Coat have raised $11 to $15 million. So given that money is available in the private space, I'm wondering why you chose or the company chose a direction where you guys decided to put this all into a listed entity, sort of make this your flagship business. How easy would it be for you to compete with private players who are raising money at high valuations, and your cells are now listed with a metal component business? Or is it that you really don't need that much capital? You can make do with what you get from your legacy business.
So when we started the transformation journey, I think there was a budget, definitely, to look at what kind of investments they could make, and they made that investment in us as a e-pharmacy and a online clinic. The potential after that, we saw we have convinced our shareholders, I think, in terms of raising capital to help with the new investments. So the last year we raised about 4.8 million in placements, and we invested into a platform company in India for, I would say, the next kind of 10-15 year kind of vision of growing this into a digital health space with wearables and IoT, and in terms of providing the ability to leverage data to personalize care. And then we looked at clinical nutrition, because that's where the wellness really mixed with health. People just don't like taking tablets, and we know that. And we wanted to cover the segment of enriched food and products that could be sold as well. And so getting JV done on Gain Food was very important for that. So we do strategic investments and not complete acquisitions at the moment. We could say we are testing as well the market response. So as we gauge that, we can actually raise as well. There's a lot of interest. We have got interest coming in asking for further placements, or whether we should get into a single country and go in deeper, which we are. So we are looking at Indonesia, doubling down. We are going to share more information as we go along on this market, because it's exciting. Halodoc is definitely a telemedicine player in Indonesia that's exciting, but it's such a big market. They haven't touched the surface or gone deep yet. There's hospitals that we are speaking to, owners of hospitals that have felt that they're left out in the digital wave, and we are now covering that segment. So I think there is I wouldn't say there's lack of capital out there. As you rightly said, there's a lot of capital out there. It's a matter of timing and getting it right in terms of, we are not going to throw this at a B2C expenses wave or just pure advertising or marketing. We are a bit more mature in terms of the team, and we have been through this with other companies, and we want to get this right for our shareholders.
Right.
Yeah.
Understood. Because very often what happens is when industries are nascent and there's funding readily available, if entities get larger funding, they can use it to actually undercut you as competitors. And just like we've seen Grab do that in the past to take share from, I know this is a very different sector, but to take share from other operators like Comfort. So in this sort of a scenario, how do you feel that this is something that could happen, or do you think that this is a more disciplined industry and it's hard to compare these things?
Personally, I feel, number one, the investors who are in the private market and the public market are a bit different. And as Dr. Vas and you rightly mentioned, I believe there's enough capital around, right? And people will have different KPIs for private versus public listed company.
Right.
As a public listed company, we have to be much more transparent, right? So every quarter or every year, you have all those reports, where some investors like. Right? In terms of undercutting, this market is very, very big. I think there are different segments. We understand there are certain areas which is very, I would say, saturated or commoditized. We are staying away from that. What we want is the ecosystem, right? We cannot compete on price, because competing on price in the long run is not sustainable. Whoever does that, will run into trouble sooner or later, right? Right. We do not want to do that, right? We want to compete on value. We want to compete on outcome, because we are talking about health. We are talking about well-being, right? We want to be here in the long run.
Fair enough. Okay. Could you talk a little bit more about your linkage with consultants for the medical space and hospitals, as it refers to with respect to Gain Health? How do you expand your ecosystem, and what is your ecosystem like currently?
Vas, can you take that?
Yeah. As in the current, we are kind of in a unique space in terms of looking at both the retail pharmacy side of it and the clinic space, and we are working to provide a kind of seamless experience for both our doctor partners, nursing partners, as well as the diagnostics like labs and things like that. The ecosystem is like any other brick and mortar ecosystem. We are just making the efficiencies improve and reduce the costs as much as possible to the end consumer, but at the same time capture more data during every interaction of these different players in the ecosystem. And it's not a new novel idea anymore. I think that's what investors should capture, if at all, right? That there's no innovation side of things. There will be very novel AI innovations and so on. But in the practical, like day to day, it is more or less efficiencies, productivity, and getting more care at a better price, and being able to ensure quality in the care. Yeah.
Okay. All right. I mean, when I asked more about your ecosystem, I was trying to understand, like, so for example, let's say, we talk about, if we talk about the players like Dr. World, where there's Raffles Connect. So you sort of immediately get an ecosystem of Raffles doctors, right? How do we think about your ecosystem in terms of doctors who you get referrals to, and how do they connect to your system?
Today, we may not own hospitals today, right? But because we are asset light, we can partner whoever we want that is mutually beneficial for us. That means the patient actually have a choice rather than being funneled into certain hospitals. We will also looking strategically into some of this specialist clinic who are keen to partner with us, right? We are in discussion, but as you know, one of our investors is Dr. Lim Chok Pang, the previous CEO of IHH Healthcare and Parkway. So he also is in constant discussion with us on how to enrich and stabilize our specialist ecosystem.
Great. All right, sounds very good. I'm now, Dr. Bernard, I'm just going to probably take a few questions from the, our participants, and I'm going to start with a question out there from Jack, and he asks, if we look at the cash from the potential value to be extracted from the metal engineering business, plus whatever you have on your balance sheet now, is that 21 to 22 million of market cap? He just wanted to confirm that. And he also adds that, reports are that, your profits could actually be close to 1 million. Does that mean that, you have a medical business, which, because cash as a percentage of market cap is almost 100%. Do you have a medical business that does not reflect the value of your share price today? And he also asks, what is your strategy around growing your and with an optimal client acquisition cost?
A very good question. Thank you very much, Jack. Of course, my answer may be biased. I would say what you say is correct, right? I believe we are, I would say our valuation does not reflect what we have today, right? And your observation, I would agree with, and we hope that the market will also agree with that, right? On your second question, that as the digital business grow, do you think the margins will be attractive? That's why we look at the segment properly. I mean, in the chronic care segment, elderly 40 years and above, we know on average, these people take at least about $30 to $50 of medication every month, right? That is excluding all the other ancillary care that they may need. If we get them and we bring them along the whole journey, we should be able to increase the revenue per patient. And hopefully with that, we can reduce the client acquisition cost. One way of getting new clients would be some of these campaigns that we do. Like recently, we did a lot of PCR screenings for pre-departure. We did a lot of stay-home notice for people who are COVID positive. Because they are in our ecosystem, we are able to reach out to them at a very low cost later, because we know they are the right age group or they have the right chronic conditions which will need further care later. Thank you very much, Jack, for the question.
Great. Okay, and I guess there's another question. Is the presence of giants in this space intimidating, and what sets you apart from your competition? I think I had asked about what sets you apart, but maybe if you could provide some more color besides, you guys getting into niche areas which others aren't, maybe that would be great.
Okay. I would probably, because the what you mentioned, giants-wise, I guess vertically integrated large tertiary groups that could go online as well and provide care, like Raffles, for example, right? And what we see is that a choice is something that people expect online. They expect freedom to move and get care when and wherever they want. And by working with multiple groups, what we have is actually that choice online and offline, and providing convenience. We are able to start with a very clean slate and not absorb all the brick and mortar costs before that these larger groups had, and they are forced to absorb that from the current online kind of services, right? Moving ward nurses out to vaccination centers and things like that might have worked for some of the current needs, but I think as the services evolve, they got to keep doing that, relearning, and a smaller, more nimble company like us are able to capture those kind of opportunities, I hope, faster. Yeah.
Great. Just on your health platform business, for especially the SaaS part, I wanted to gain some understanding into what sort of analytics and data you will provide, and also again, what sort of separates you in those analytics that you provide from what is available with hospitals and others right now.
So there's platforms like electronic medical records and hospital information systems. That is what's standard out there today. What we have added in terms of both telemedicine, patient engagement tools, analytics, these are things that are missing. They don't gel together sometimes with very structured electronic medical records. So telemedicine, I think, is where we found that these tools are better developed, and then we're bringing this to the brick and mortar world today, right? And so we'll keep bringing a much lighter platforms that's engaging the well patient with e-commerce and other social aspects, and not just the healthcare part, which is what most hospitals and clinics invest in. Yeah.
Understood. Okay. What are your KPIs going to be over the next 4 to 5 years? Like, how do we measure you and say you've been successful, and what are the things we have to look at in the next few years?
As in any So I'll start first, right? As in any public listed company, we want to show that our top line and our bottom line continues to grow, right? And how we get there will be our strategy, which we will outline as we move along, right? Number one is our revenue needs to be sustainable. So meaning our clinical arm needs to continue to grow revenue. Our software, or the digital part, needs to continue also to grow revenue. So these are the two things that we will need to see. But as you know, to reach there, we may not be able to reach it organically, right? So inorganic growth could be another thing that we will consider to continue to deliver the value to the shareholders, right? So Vas, maybe you want to add some color to that.
Yeah, I think we may have opportunity here where other private companies may not have, with more open, transparent reporting structure. We want this kind of drive for our team, and the kind of opportunities we can showcase as we see them. For example, as I said, in Indonesia, we do see that the numbers will, as they come out, we would be able to identify segments, and people will approach us for such inorganic and other opportunities for growth, right? So I guess we have opened the kimono, right, kind of thing in digital health, and we have said, let's be transparent, and let's grow together and show that there are successful business in this region for such category. Yeah.
Understood. Okay. So we've also seen recently that you entered into a sort of collaboration with IMEDIS on providing virtual space for medicine. So maybe if you could elaborate on that, and do you think that there's a revenue stream that you could get from there, or is that something really far out, and how would that work?
We looked at as I said, there's always a roadmap of innovation that we want to be part of. And this group had existing developed metaverse in healthcare in Europe. And they are finding potential partners around the region and globally. So we really saw an opportunity and we seized it. In terms of developing the specific kind of spaces in localized spaces in Singapore and this region, we are in the process of doing it, and we find a lot of exciting opportunities for varied ages, right? The younger or the older, both can experience this in a different way. Younger might actually be used to it, and they like the privacy, they like the remoteness. The elder ones may like the convenience of rehab at home. We do see opportunities, and we are looking at deploying them pretty quickly where we can. So in the next few months, we would like to see our elder homes market with a rehab solution potentially, and so on. So yeah, it's not a moonshot. It is something that's happening around us, around the world. We are trying to test out the market and be careful and not develop the whole thing ourselves. We are letting startups like this AI Medis in Europe develop it, and we will license in. The thing about Metaverse, the other key part, is not just a 3D space. The Web 3.0 is about security, blockchain process. The data security is something that is built in for this platform. So all the information being shared or the authenticity can be tested. So that's something very important in healthcare, that information that's being shared is real and content can be verified. So it's a new web kind of environment, and we wanted to be in it. And I think we started well with the right partner for now, and we will continue looking for such innovation. Yeah.
Thank you. Special thank you to Dr. Vas and Dr. Bernard for giving us a detailed insight into Meta Health, the opportunity and the challenges in the healthcare and the e-commerce sector, and how Meta Health aims to overcome them and make the most of the opportunities. I would also like to thank our attendees who were able to join us live. Thank you so much, and thank you for your questions as well. And thank you everyone for joining today. With this, we will wrap up today's session and we will see you again in the next webinar. Thank you.